Hafaday, thank you for joining us for the presentation of Legislative Resolution number 388-35 COR, which is relative to recognizing all of Guam's nurses for their commitment to providing quality healthcare to the people of Guam and commending them for their vital role and perseverance in the COVID-19 pandemic response and recovery efforts on Guam. It's my honor and privilege to present this resolution today on behalf of the Guam Legislature and the people of Guam. Thank you to my co-sponsors of the resolution, Senator Sabina Perez, Senator Kelly Marsh Taitano, Senator Tello and all senators. And I'd like to thank my colleagues who are present here today, Senators Sabina Perez, Senator Tello Senator Jocelyn Augustine, Senator Amanda Shelton. Thank you for attending this afternoon's presentation. So when they announced that 2020 was going to be the year of the nurse, they surely called that right, didn't they? I'd like to acknowledge that many of Guam's nurse leaders are here with us today, and the numerous nurses serving in government and private facilities around the island. And we are very honored by those who are able to join us today. We know how very busy you are. So we appreciate your attendance as we take this time to recognize and commend your hard work, courage, your contributions to the health and lives of our people, especially during these challenging times. I'd like to recognize especially Rose Greeno, Guam Nurse Association President. She's really the impetus behind this resolution. She convinced me that despite how busy you all are, how precious every minute of your time, nurses' time is these days, that recognition and celebration, even during these challenging times, should not be delayed until we could be together in person. It is, after all, the year of the nurse. Suzanne Labaton, who is the Vice President of the Guam Nurses Association, Glynis Almonte, the Guam Nurses Association Executive Director, Evangeline Allen, who's a member of the Guam Nurses Association. She's also a member of the Board of Trustees of the Guam Memorial Hospital Authority. Pauline Lizama from Guam Memorial Hospital and the DOC Clinic. Margarita Bautista Gay from the Department of Public Health and Social Services, Administrator for Community Health Nursing Services at the Bureau of Family Health and Nursing Services, COVID Community Testing Lead. Xenia Pesina, Administrator of the Health Professional Licensing Office at the Department of Public Health, Executive Director for the Guam Board of Nurse Examiners, and Nursing Resource Command Chief for the Department of Public Health and Social Services. Dr. Carla Haddock, President of the Guam Association of Advanced Practice Registered Nurses and Nurse Practitioner at Marianas Physicians Group in Guam Regional Medical City. Dr. Margaret Hattori Uchima, Dean of the University of Guam School of Nursing and Health Sciences. Karen Cruz, retired nurse educator from the University of Guam School of Nursing and Health Sciences. Dorothy Lu Manglotna Duenas, Nursing and Allied Health Administrator at Guam Community College. Virginia Tadella, Dean, Guam Community College School of Trades and Professional Services. Pilar A. Williams, Associate Dean, Guam Community College School of Trades and Professional Services. Gia Blancaflor Ramos, President of the Guam Visiting Nurses. Jennifer Artero, Clinical Services Manager at FHP and also Nurse Jen on KUAM. Carmencita Atalik from FHP. Annalyn Gagarin from FHP. Gia Raisa Ashley B. Ramos. All right, so I'd also like to recognize the attendance of Senator Will Castro. Thank you very much, Senator, for joining us today. And so before we begin with the resolution presentation, I'd like to ask for a moment of silence in honor and remembrance of Marnette Penarubia Agabao, fondly known as Bobby. Marnette was a registered nurse who worked in the ICU and ER at the Guam Memorial Hospital and dedicated her life to helping patients in our community. She was a COVID-19 frontline hero who had succumbed to complications of the coronavirus. We send our deepest appreciation and condolences to her family and her colleagues, as well as all nurses and frontliners who have lost their lives, who have been deeply impacted by the lives lost by this pandemic. So we pause now for one moment of silence. Thank you. Again, thanks to all who have joined us today. to recognize and commend all of Guam's nurses for the very essential role that they play in the quality of healthcare provided to our people, and to thank them for their perseverance and commitment to serve during this perilous time of the COVID-19 pandemic. The risk to your health and life is great. There are no proper words to convey the sincere gratitude that we all have for your continued efforts to protect lives, knowing the risk to yours. Earlier this week or over the weekend, we had the Guam Nurse Association put on a small appreciation and recognition event for the UOG class of 2020 graduate nurses. And I'd just like to share an excerpt from some of the remarks that I made at that apply to, of course, all of you nurses and all those that are watching. Nurses are the backbone of our healthcare systems, locally and globally. It's ingrained in our culture to take care of others, and nurses embody this value. There may be opportunities elsewhere that will pay you more or enable you to provide a better living for yourselves and your families. It's incumbent upon us as leaders, now more than ever, to truly recognize the value of nurses on our island by prioritizing the improvement of nurse compensation, benefits, safety, professional development, and supportive services, so that you're not left to make the hard choice to leave your island or this profession based solely on pay and working conditions. You've all clearly put the people of Guam before yourselves, and for that, we are truly grateful. I pray that you all continue to choose to serve the people of Guam and bear with us as we work towards these improvements. COVID-19 has shown us all how fragile life is, regardless of circumstance, and we are all called to action to help our community heal from the direct and indirect effects of this reality. Thank you to each of you on the front line of this fight for bearing courage, commitment, and the gift of your healing hearts and hands. Your willingness to serve our people during this most uncertain of times is awe-inspiring, and it is now and forever part of Guam's history. It is truly an honor and to recognize and commend you on behalf of the Guam Legislature, people of Guam. And so now, without further delay, we will present this resolution, and my colleagues in the Guam Legislature are going to help with this presentation. Resolution 388-35, relative to recognizing all of Guam's nurses for their commitment to providing quality healthcare to the people of Guam, and commending them for their vital role and perseverance in the COVID-19 pandemic response and recovery efforts on Guam. Be it resolved by the Committee on Rules of Imina 35 na Legislature in Guam. Whereas the World Health Organization, who's designated 2020 as the Year of the Nurse and Midwife, in recognition of the vital roles nurses and midwives play in providing health services worldwide, and in commemoration of the 200th year anniversary of the birth of Florence Nightingale.
Whereas this year also celebrate the 69th anniversary of the Guam Nurses Association and their commitment to improvement of health standards, and the availability of healthcare services for all people, to foster high standards of nursing care, and to stimulate and promote the professional development and economic and general welfare of nurses. And
whereas on March 14, 2020, a public health emergency was declared on Guam due to the potential dangers posed by the introduction of the 2019 novel coronavirus, COVID-19, to the island. And since then, all of Guam's nurses have been at the forefront of the COVID-19 pandemic response and recovery efforts, working tirelessly to keep the people of Guam healthy and safe.
Whereas nurses and midwives are essential to Guam's healthcare system and play a vital role in providing quality healthcare to patients in the community. Collectively, they are a cornerstone of patient care and true leaders in their respective fields. By nature and training, they are consoling and caring individuals defined and motivated by compassion. Nurses and midwives set high standards for themselves and constantly strive to exceed those standards. Each and every one of us have been cared for by a nursing professional. And so, in full accord with its long-standing traditions, y Legislatura en Guam, commends and honors members of our community, such as the Guam nurse and midwives, whose diligent service has greatly contributed to the well-being of our community. Now, therefore, be it resolved.
That the Committee on Rules of Imina 35 na Legislatura en Guam does hereby, on behalf of the Legislatura en Guam and the people of Guam, recognize all of Guam's nurses for their commitment to providing quality health care to the people of Guam, and commend them for their vital role and perseverance in the COVID-19 pandemic response and recovery efforts on Guam. Senator Therese, if you could join me on this.
Resolved that the Speaker and the Chair of the Committee on Rules certify and the Legislative Secretary attest to the adoption hereof, and that copies of the same be thereafter transmitted to the Guam Nurses Association and the Honorable Lourdes A. Leon Guerrero y Magahagan Guahan, duly and regularly adopted by the Committee on Rules of Imina 35 y la Legislatura en Guam on the 20th day of the month of October 2020.
Thank you. In celebration of this special event, we've invited some of the nurse leaders who are present to make remarks, beginning with Rose Greeno, Guam Nurse Association President. Of course, if we were in person, we would be handing you this resolution, and I regret that we're not able to do this in person, but please, let's celebrate as best we can, beginning with Rose.
Thank you, Senator Terlaje, for working with us, GNA, and introducing this resolution number 388-35 in recognition and appreciation of all nurses and midwives in Guam. Thank you to Senator Sabina Perez, Senator Kelly Marsh, Senator Telo Taitago for sponsoring this resolution. And thank you to the rest of the senators, Senator Joe Agustin, Senator Amanda Shelton, Senator Will Castro, for your support today. This is so fitting, as I mentioned earlier, as the year of the 2020 is the year of the nurse and midwife. I am humbled and really heartwarming on this appreciation that's coming out from our policymakers. During this pandemic, the nurses continue to play a pivotal role as a frontline healthcare professionals in the hospital, public health, clinics, home, school, and the community. Nurses go above and beyond, made sacrifices in putting ourselves at risk to provide compassionate care to our people. I do urge the community to support and do their share to support the frontliners. As a community, we should use these moments to inspire and uplift us to face these challenges together. A nurse can only deliver safe, professional, and holistic care during this pandemic with the help of the community. To all my fellow nurses and healthcare professionals, I do applaud you for your continued commitment, dedication, courage, and selfless sacrifice during these trying times. May God mercy and blessings of protections be with us all. Thank you so much, Senator Terlaje.
Thank you, Mr. President Greeno. I'd like to now recognize Dr. Margaret Victoria Uchima.
Thank you. I just want to express my appreciation to the legislature for recognizing nurses. Some of us find it, we don't mean to laugh, but you know, it's so ironic, right? There's Dr. Haddock smiling. That, you know, it's the year of the nurse and midwife, and then here, you know, we have a pandemic. This is not the way we hope to celebrate our profession. But just, you know, I want to thank people for their appreciation. But, you know, today, this has been a difficult week, and I see our GMH nurses on here. And I don't know if GRMC is also on here, but of course, there's Margarita Gay and Zena from Public Health. And those are our true heroes today, our true frontliners. You know, the rest of us here are our support staff. You know, we're their cheerleaders. We're the ones, you know, trying to keep the programs going so that we can have more nurses that can help them out. But I just really want to say, you know, to them, you guys are our heroes. And we wish we could do more to support you. And I know the whole community should be so thankful for what you're doing, because you're stepping up to this terrible pandemic. And we all know, we've all complained about the lack of resources, and both at public health, you had a fire, you were displaced. GMH, it's an old facility. But I have to tell you, even mainland nurses, when we've had visitors, everyone always says the Guam nurses have the biggest hearts, and the Guam nurses are so intelligent. We have to celebrate each other when we can, and try to lift each other up, because we're all tired. There's Pauline, DOC as well. Sorry. Every one of you that's on this call, and all our nurses that might be watching, our hearts go out to you. And I just, really extend our deepest thanks from the whole community. And thanks, Senders, for recognizing nursing. We'll keep trying to do what we can do for the people of Guam, because it's the island that we love. Thank you.
Thank you. Very much appreciate all the work that you and everyone has done to help each other and lift each other up. Ms. Zenia Pesina, Administrator for the Health Professional Licensing Office.
Thank you, Senator Terlaje and members of the 35th Guam Legislature. There's so many things I want to say, and I hope I get through it without being too emotional. But first off, I wanted to thank you for acknowledging Marnette. Marnette was not just a colleague to me, but she was a very good friend. So thank you for that. And I know she's smiling and wishing she was here. So secondly, I wanted to, you think of nurse leaders as not being frontliners, but they actually are. So in the beginning of the pandemic, from March on to present, I've actually worked very closely with a lot of nurse leaders. I wear two hats. So I currently wear the hat as the Health Professional Licensing Board Administrator, and I also work for the Department of Public Health and Social Services as the Chief of the Nursing Resource Command. And from the beginning, we started out with recruiting nurses. And believe it or not, when all the nurse leaders got together and started to recruit, I'll give you a really good example. Public health had 14 nurses to cover public health in this pandemic. And we ended up recruiting over 100 plus nurses. But thank you to the executive order of the governor that we were able to waive a lot of the requirements for the licensing. And we were very flexible, and we're very, we're very innovative when it comes to getting or building and expanding the nursing workforce. So with that, we were able to utilize them in many areas, not just public health, but also our local hospitals. And lastly, so I wanted to thank those leaders for being there, because it's really important that we recognize them too, because they worked really, really hard and diligently during the pandemic. And lastly, I wanted to thank the public health nurses. I mean, you don't hear too much about them being in the front line, but believe it or not, from the beginning, public health, we had to get nurses out there to protect our borders. And this is really important, because without protecting the borders, we would not have food for our tables and all the necessities that we need for our people to continue on with our daily living. And so we built clinics at the Port Authority. We built clinics at the airport. We also created a call center where the community can actually call in for any questions. And we had like hundreds and hundreds of calls from the community asking for assistance. We also worked on building a isolation facility and providing services for people who were positive COVID. So we did a lot of, and Margarita can probably talk more about our outreach and all our engagement teams. But if you, the hospitals, you have a lot of hardworking nurses, public health, oh my gosh, we can't applaud them enough. We're all out there in the heat and the mosquitoes, and I always laugh about how dark I'm getting and all the mosquito bites we get, but we continue to do it, and our journey has not ended. We opened up and started since March. We continue to fight the COVID fight, and I wanted to thank all of them. I mean, nursing is resilient, and we can't stop and we can't stop appreciating them and saying thank you enough. So I wanted to thank all my colleagues also. You know, sometimes I think Florence Nightingale, the mother of nursing, is actually trying to teach us a lesson, because she came up with hand washing, right? We were supposed to hand wash, and she was the mother of hand washing. And then all of a sudden through the years, we somehow forget and we're not meeting our quota to wash our hands frequently. And so now here it is, COVID, and she's telling us, guys, go back to basic nursing, wash your hands, sanitize. And so yeah, so I just wanted to thank everybody, and thank you, senators, for this. It's really heart warming, and yeah, so thank you.
Hang in there, Xenia. It's very true, because when I try to get a hold of these administrators at Public Health, they actually are out in the field always. That always is the case. So, and speaking of public health, I would like to now recognize Margarita Bautista-Gay, Department of Public Health and Social Services Administrator for Community Health Nursing Services at the Bureau of Family Health and Nursing Services, and the COVID Community Testing Lead. You've seen her in the newspaper because she's the one out there testing, and I think I've seen her myself when I had to get tested as well. Margarita. Margarita, if you could unmute yourself, plus the mute.
Oh, sorry.
Thank you.
Sorry. Again, Sejus Masi, Toru Hanzu. Thank you, everyone. Our legislative senators, our fellow colleagues, leaders, everyone here today. It's my great pleasure to be with you all. And thank you. This little recognition means a lot to all of us. Like you said, it's hard to to express our gratitude to everyone, because we're all in together. In every little way, all of us are trying to take care of Guam. And if it weren't for all of us here, we have our stumbles right now, but we're getting through it. And just remember, we're a little island, but this little island have strong nurses, strong people here to make a better outcome for all of us. So I like to thank everyone for being here, and for everyone doing their little part in every way. Our dedication to our nursing career and to public health is everything to us. And just doing what we can make a real big difference. So like Xenia said, the public health nurses, I want to say thank you to all of them. And they all are new nurses that all became part of us. We wouldn't have done it. We have a way of doing our job anytime, anywhere, when we're needed. But at the end, our mission is there to serve the people of Guam. Thank you for your leadership, our risk taking, just being the nurse that you are, the caring, supportive, and advocate, and especially providing the special care, working together to our community of Guam. And like Xenia said, yes, we are the frontliners. All of us are the frontliners for the health of Guam. And we just want to recognize all your work. I too do hospital work too, but lately we're on hold because the main focus is community for me. And then I can say so much for, it's so hard to say thank you to this group of my nurses here in public health. We go out from starting since March 15, out there to the airports, out there in the community, serving the homeless. And we go through the different at-risk communities, from the prison, from the convents, the elderly. We were out there to the senior homes, to the St. Dominic's, and just out there to care. And at first they weren't there. They didn't understand why we have to get tested. Why we're always educating and educating. It's and then now look at now that at it grown, but we were there to see it all. Like I was saying, I was educating the students at the university and at GCC and our behavioral health nurses and public health. And little did we know COVID. We don't know what the COVID virus was all about. But as soon as we finished, turned around, here it came, and we all learned together. We learned from CDC, but we all learned it together, and we all worked to make the pace of how it is supposed to run through. And I appreciate everyone's support, like Dr. Margaret. um, it, it it had to be the start with starting to educate, and that's what we do. We're like, I always tell everyone, we're like our little public health office. When you see a public health nurse, you see a public health. So they have a range of questions for us, from food stamps, from prenatal care, from health certificates, and so we are there, and we're there for them, and we try our best to do what we can. And with this COVID, we've been in every direction, and we're still there. We're still together. We're still strong, and we still have to remember to keep ourselves safe, because if we are not safe and healthy, we're not able to help our people. And so thank you everyone for all that we do, and especially of course my nurses out there from public health. I wouldn't have done it without all of you, from the volunteers, from our outreach to our call center to our isolation and QFAC. All these nurses are there for all of us. So thank you everyone, and thank you senators for all that you do for us too. Thank you.
Thank you, Margarita.
Thank you.
I'd like to recognize Dorothy Lou Manglotan Duenas, Nursing and Allied Health Administrator at the Guam Community College.
Good day, everybody. Thank you. First of all, I just want to say that I am completely humbled to be a part of this proclamation with my fellow nurses and colleagues. Words cannot fully express the gratitude that I have for my fellow nurses and all the hard work that they are doing, most especially the hospital nurses and the Department of Public Health nurses. From day one, they have been out there putting 100% of themselves to help combat the COVID-19 pandemic. We also have a majority of our faculty and our student nurses who are out there and who, without hesitation, responded to the call from the start. So I am completely humbled, and I am so thankful for all of the nurses and all the hard work that we do to help support each other. GCC and UOG are collaborating to try to meet the training needs for our community. We will continue to do so, and we will continue to see what we can do for our community and our fellow nurses. So because we are all in this together and trying to fight this pandemic together. So thank you, senators, and thank you, fellow nurses and colleagues. I am so appreciative of everything that you all are doing.
Thank you very much, Ms. Duenas. Karen Cruz, retired nurse educator from UOG, School of Nursing and Health Sciences. Oh, if you could unmute, press the mute button. Yeah. Wait, I still can't hear you. Try again. Yeah. I'm sorry, Ms. Cruz, I still can't hear you. I'm not sure if, I'm not sure why I can't hear you. Maybe could you try getting off and getting back on, and we will get back to you. Okay, don't give up. We'll get back to you. Try it again. Let's go though now to Dr. Carla Haddock, President of the Guam Association of Advanced Practice Registered Nurses and Nurse Practitioner at Marianas Physicians Group and Guam Regional Medical Center.
Hafa day, everybody, and senators, thank you for the resolution. It's so refreshing to see all of our nurses here that I work with as my colleagues or who have somehow shaped my career to where it's been today. I'm forever grateful for the nurses on Guam and for everything that you do. And being on the front lines, working in the ER at GRMC, I see all the struggles that we have gone throughout this pandemic. A mere 2 years ago, we got through the 34th legislature with the enactment of Public Law 34-78 allowed for full practice authority for our advanced practice nurses. And with that bill, it really allowed for us to be able to practice to our full capacity. And I'm looking at so many of the people here who helped to shape that law, who provided testimony, who are our cheerleaders, as you said, Dr. Hattori, and really helped to pave the way so that we could continue helping the island that I love. And while this resolution is nice, I also implore you to please continue to do and support our nurses with your policies. As you know, we have Bill 239 still stuck in committee, Senator Terlaje, which is the Nurse Licensure Compact. And I really think helping to get legislation out there that really supports our nurses and our nursing profession will do more. Hopefully in the next year, we can also have laws to help with our nurse pay, to help with more recruitment and more retention, and establishing a nurse practitioner position within the government of Guam. I appreciate all my nurses. I'm here for you, and I love you so very much. Thank you again.
Thank you very much, Dr. Haddock. Is Gia Ramos here?
Hi, Senator. Yes, I'm here.
There you are. Oh, please. Okay. So Gia Ramos, President of the Guam Visiting Nurses.
Hi, Senator. Hi, everyone. I'm with Guam Visiting Nurses. I'm the Executive Director with GVN. I've had the honor to have also worked at Guam Memorial Hospital years ago. So I've done hospital nursing, I've done clinic utilization, management nursing, and now I am in home care. But first of all, I want to give appreciation to our hardworking senators, Senators Therese Terlaje, Senator Sabina Perez, Senator Kelly Marsh, and Senator Terlaje for their tireless efforts and time out of their busy schedule in introducing this resolution 388-35. This resolution is in recognition of our heroes, all our amazing Guam nurses, our professional registered nurses, as well as our licensed practical nurses and our midwives. I just want to also share some recent data. A recent WHO report of data collected from 191 countries show that nurses represent 59% of all healthcare professionals. At least 6 million nursing jobs need to be created to offset the projected shortages around the world, inequitable distribution, more specifically in low-income countries. Now, while more than 60% of American workers have been fortunate to work at home to minimize spread and exposure from COVID-10, our brave nurses took front seat and front line to help combat this COVID-19 pandemic. Recent CDC data has also shown that among healthcare professionals hospitalized, unfortunately, with COVID-19, 36% were in nursing-related field. That is over a third of all hospitalized healthcare workers. Now more than ever, during these unprecedented times, our nurses are saving lives around the world as they work the front lines and sadly, more too often, the end lines during this COVID-19 pandemic crisis. Never have we encountered and embraced anything like this. Our nurses have been impacted beyond measure as they have had to deal with the multifaceted consequences of this pandemic, which has caused horrific, heart-wrenching suffering and pain. While the saying, healers are called to heal, despite their fears, psychosocial dilemmas, and many uncertainties, our nurses have embraced their role as healers and worked courageously and tirelessly in all healthcare settings to a point of exhaustion and frustration, but continue to forge on. Our heartfelt and sincere thank you and kudos to all our Guam nurses in all varied healthcare settings where they work for your continued exemplary bravery and care to our patients. I would also want to shout out and highlight an often forgotten area in specialty nursing, such as home healthcare nursing. I just want to say that we, your colleagues at Guam Visiting Nurses, give kudos and applaud all home healthcare nurses who have bravely taken care of patients in their homes, despite the high risk of exposure in the community. They have endlessly and without hesitation accepted hospital discharge patients so that these patients can go home and continue their care at home. Home care nursing plays an even more significant role now with the recent overload cases in the hospital. Patients can be discharged to home once they're stabilized, and home care nurses and therapists can take over the care of numerous patients needing continued IV antibiotics, which can last up to 6 to 8 weeks at times, wound care treatments, which could take years for these wounds to heal, chronic disease management to help keep these patients from developing complications and end up in the hospital, and also home rehab therapy for stroke and functionally disabled patients. Home care nursing works side by side with the hospital to help stable patients discharge and continue their medical care safely in their homes with our home care nurses. They are more often forgotten, and I want to give my applaud and kudos to them too. It is with sincere gratitude that we thank you again, Senators, for uplifting those who save lives every day and for bringing recognition to our amazing registered nurses and licensed practical nurses and midwives. We know that you will continue to be supportive in our mission to provide access to nursing care and services throughout our community and support us in policy making to make lives and workplace better for our nurses as well, that can benefit our community. May God bless all our nurses and all of us. Thank you so much, Senators, for your time.
Thank you very much, Ms. Ramos. I'd also like to recognize that Ms. Ramos is also a member of the Guam Economic Development Authority Board of Trustees, and
thank you.
And, she has been pushing. She's on the. I think she heads the subcommittee on health, and we've been working closely with her. She's working to increase the workforce development of course, the healthcare industry on Guam. And in fact, there's so many accomplishments to congratulate here, including the recent work of Dr. Hattori, GIDA, Department of Labor in trying to, and GMH in a very, and GCC in a very rushed urgent way to increase the number of CNAs that can get into the hospitals right away to assist in those programs. And so all of these concerted efforts I very much appreciate, and I know they don't often get recognized to the full extent, and we can't do that all today, but I do want to appreciate those. And I want to assure all of you, I know many of you, have voiced your, oh, I'm sorry, before I go on, can we try again? Ms. Karen Cruz, let's try again, please. Mm-hmm. I'm sorry, I can't hear you. Try pressing the volume on, I don't know if that would help, but okay, try one more time, Ms. Bruce, please. Just try to, let's see if we can hear you. Ms. Cruz, can you try, see if we can hear you again? Speak loud. No, I am so sorry. I can't hear you. I apologize again for this Zoom platform that we have to do today, but thank you so much. I understand you are retired right now from the University of Guam, living off island, and that you've joined us today to also join in commending your fellow nurses. But so thank you very, very much. I apologize. All right, Suzanne, concerns. In the meantime, we wait for GMH to also issue to us, as the Board of Trustees has promised to get to us a revised nursing plan or structure for the nurses at the Guam Memorial Hospital. And they are expecting this at their next meeting of the Board of Trustees after today's meeting. And of course, we can discuss these things in great detail as we go forward. Okay, so I think we were having some technical issues, but we're back on. All right, so we're going to continue with a very short, I'd like to invite Ms. Suzanne Labaton, Vice President of the Guam Nurse Association, and Dean Margaret Uchima to help us give some special recognition to the 26 members of the class of 2020 UOG. These are nurse graduates who made the courageous choice to graduate early to be able to work as graduate nurse and be part of Guam's nursing workforce during the time of the pandemic. I think we have a very brief video to share as well, or PowerPoint.
All right. Okay, Hafaday, everybody. Hafaday, nurse leaders, my nurse colleagues that are on this call, and senators. A big Sizu'as Ma'asi for allowing me the honors to briefly speak about how all 26 of the University of Guam class of 2020 student nurse graduates stepped up and made the very difficult decision when asked to graduate early so that they can enter Guam's nursing workforce as a graduate nurse during a time that our island was in most need. A life is not important except in the impact that it has on other lives. This message is a quote by the famous American baseball player, Jackie Robinson. Now let's just take a brief pause and think about that for a few seconds, okay? A life is not important except in the impact that it has on other lives. Now this message resonates so deeply with me, and I believe the essence of this message is similar to the very, very basic reasons that each of us have answered the call to become a nurse. The heart of this message really reminds me about all of our UOG nursing class of 2020. The one thing that actually matters is the impact that we have on the lives of others. And when you think about it, this really is the closest thing to being immortal that we as humans can achieve. We live to help others live better. We live to improve the quality of other lives. And all of our UOG class of 2020 did just that. A few months ago in May, when they decided to step up and graduate early to enter Guam's nursing workforce. And they continue to do just that each and every day that they report to duty. As a matter of fact, I actually wanted Ms. Pauline Perez, who's the immediate past president for the Student Nurses Association of Guam, to actually be present and speak. But right now she's on duty at the GMH emergency room. So she couldn't be with us today, but she really, really wanted to. Their courage and their bravery, their dedication and their commitment, their leadership, it's all inspiring to us. And as the vice president of Guam Nurses Association and the chairperson of our recognition and awards committee, I want all of Guam and I want them to know that really GNA's mission is to promote the nursing profession. And that's why we are here today. On behalf of GNA, the Guam Nurses Association, and all of Guam nurses, a big Sidzuis Ma'asi to our senators, Senator Therese Terlaje, Senator Sabina Perez, Senator Kelly Marsh Taitano, Senator Tello Taitagui, Senator Will Castro, Senator Amanda Shelton, and all the senators on this call that I may have missed, and the 35th Guam Legislature for recognizing and highlighting our nurses for the work that they do and the huge impact that they have on the lives of others and on the healthcare system on Guam and in our region. So today we celebrate our newest members of Guam's nursing workforce, the UOG class of 2020, along with all of our nurses on Guam. And this slide here is a group photo of the class of 2020. These are, please note, for message for the public, this is taken before COVID, so you won't see any social distancing here. So this is before the COVID pandemic. And in the next slide, in the next slide, we proudly list the names of all of our student nurse graduates from the class of 2020 and their designated agencies. And their designated agencies include the Department of Public Health and Social Services. Many of them went to Guam Memorial Hospital and the Guam Regional Medical City and Health Services of the Pacific. Without hesitation, they entered specialty areas such as labor and delivery, the nursery, the medical surgical units, medical telemetry unit, the emergency room, the ICU, and home health. Their contributions to the COVID pandemic response and recovery efforts are very inspiring and much appreciated by GNA and the rest of our island community. And in the next few set of slides are some very quick photo highlights that I wanted to share with all of you. So the next slide, we have group photos, again, taken before the COVID pandemic. And these are of the students with their clinical instructors during their clinical rotations. They did rotate through many sites, but these photos here are taken at GMH Pediatrics, the Pediatric ICU, the Progressive Care Unit, and the Medical Surgical Unit. And on the following slide, our students at the UOG, they're very community oriented. And so these are some photos of them on their many community outreach events. And here they can be seen working on the Guam Homeless Coalition and the dengue prevention efforts. The following slide are some group photos of the students taken outside of the School of Nursing and Health Sciences building at the University of Guam. And it was taken before they embarked on to one of their many program activities and clinical rotations. And on the following slide, these are some of the photos of our nursing students who had a very amazing opportunity to gain exposure to Guam's newest nursing specialty at the National Institutes of Health in Washington, DC. And this is taken with the NIH leadership in the summer of 2019. And so our graduates, they received hands-on training that was focused on clinical researching practice that in care for patients often with advanced cancer or other diseases that haven't responded to other treatments and who have agreed to participate in experimental research. And on the following slide, these are photos that were taken during the COVID pandemic. And here you can see some of the students training on their clinical skills at the UOG simulation lab, students learning about infection control at the UOG gym. And you can also see them getting their N95 respirator fit testing completed. And last but not least, the last couple of slides are the photos of their virtual graduation that took place in early May 5th, when they decided to go ahead and graduate early so they can enter the nursing workforce. And that is all I have.
Thank you so much, Suzanne. And if I could just try one more time with Miss Karen Cruz. No? Okay. All right. But I'd like to acknowledge, I didn't mention it earlier that Ms. Karen Cruz, she's not only a retired educator at the University of Guam, but she lives off island, but she also came out of retirement to help us in the call centers during our COVID pandemic. And so I want to thank you very much for that effort and for being here with us today to commend your fellow nurses. Is there anyone else who I missed? I see we have some of the representatives from GMH also here now, and I know that your time is precious. If there's anyone I missed, if you could just raise your hand, wave it around a little bit. If not, I would like to give my colleagues some opportunity to, I understand we were cut earlier in the YouTube broadcast. So I want to just repeat something that I said earlier, and that was that I know that nurses, in addition to the care that you provide, you're also very much advocates for the community, for your patients, and for your profession. And I very much appreciate that. And so I just wanted to assure you that their bill regarding the compact licensure is not stuck in the committee. It's simply in the committee because after the public hearing, we are reviewing some of the legal issues that were raised, some of the potential impacts on the current government efforts to expand local nursing capacity through the University of Guam and GCC, and to ensure that these do not have negative impacts on these programs that we've been trying to grow for many, many, many years. And any additional input that you have on that or any other bills, please, very much welcome. So thank you. And and we are also waiting for the Board of Trustees at the Guam Memorial Hospital, who has assured us that they will provide to us some recommendations as to nursing structure and pay at the hospital, hopefully as early as their next board meeting after today's board meeting. And of course, there are many issues, as I said very early in my remarks, that affect all of you in each of your capacities that we also try to address and try to address, with a balanced approach for the entire community of Guam. So I will now allow Senator Jolson Augustine brief remarks.
Thank you, Senator Therese. I'd like to first, number one, for Dr. Carla, I think, are you referring to Bill 415 that we just got? The one with the pay to provide additional funding to do the pay plan? We just got that a couple days ago, and we're going to schedule that hearing real soon so we can just get that going and be done with it. But, I'd like to also, number one, and to all the nurses, thank you. Thank you, and God bless you. God bless you for all that you do. And that, and I extend also a God bless to all your family for actually having the courage to support you in what you do, because, your job is not gosh, it's a rough life. The only thing I'm just kind of disappointed because I don't see any men nurses. Where are they at? But I know they do exist, and I understand. But you know what, ladies and all the nurses, thank you very much for what you do, and God bless you. And if you ever need any help, reach out. Carla knows how to reach me. I see her in the commissary often, so you can, Dr. Carla. So if you need any assistance, and if in any way I can assist you, and I know Senator Therese does the same thing, and all the senators in the Guam legislature would love to help the nurses. And any way we can help, let's just do it. You are the frontliners. There's no doubt in anybody's mind. You're the folks that we have to turn to. You're the folks that my parents turn to at GMH or when they go to GRMC. So, again, thank you, and God bless you. And please take care, be safe, because we're always going to need you folks every day. We hope to see you. All right, take care. Thank you, Senator Therese.
Thank you so much, Senator St. Augustine. Senator Paris?
Thank you, Senator Terlaje, for creating this resolution and for spearheading and your leadership in overseeing our health community. But I just want to extend my sincerest thank you to all the nurses here that are with us here and listening in. I definitely felt, I have heartfelt, as you were speaking, I could see the dedication and passion that you bring to your profession, and that how healing that is in your interactions with our patients. But, I do also want to extend any opportunities to assist in whatever you need, to support you in whatever way, in policy making, or whether it's self-care. I'm willing to organize self-care events too as well, because I know you need it. Our hearts are with you, and we're with you in this fight as well. So Siduos Masi.
Thank you, Senator Paris. Senator Amanda Shelton?
Thank you very much, Senator Terlaje, and I'm absolutely happy to be here with all of you to celebrate the Year of the Nurse and all of the work that you're doing in our community today, and you've been doing for many, many years. I think it's only right that we're doing this, even though we're in a very solemn time as a community, that we're still able to recognize the work that you do, and thank you for the work that you do. And I was reflecting during all of the remarks about how far-reaching the nursing profession really is, from education and licensing to public health, to our hospitals, community outreaches, our clinics, and home health care. There's just so much that you all do in so many different parts of our community. So thank you very much for your time and the talent that you share with everyone. And even in this time of pandemic, you're working hard to adapt and to reinvent yourselves. And I'm just in absolute awe of everything that you're doing. And while building up the nursing workforce, I think it's amazing. And as if nursing and healthcare wasn't challenging enough on island before the pandemic, I'm sure you've all had the longest 8 months of your lives. And so with heartfelt gratitude, Siduos Masi, and I look forward to supporting you in any way that I can and voting in favor of the Nurse Compact Act when it comes to the floor. So thank you very much, everyone.
Senator Shelton, and my co-sponsor of this resolution, Senator Terlaje, Minority Leader.
Siduos Masi, Madam Chair, for this opportunity and for including me in this resolution. The work of the nurses now more than ever is really critical in every section of healthcare system. Our nurses are especially helpful at the bedsides of our family and friends who are struggling to survive COVID-19. And without the presence and support of their loved ones, they're there for us. And the care and compassion our nurses carry, their hearts, and demonstrate in their work, that they demonstrate in the work every day, it reflects the beauty of humanity in this noble profession and what it's built on. Sorry, getting emotional about this because it's true, when we can't be there with our loved ones, you are there for us. And I thank you with all my heart. Siduos Masi, Siduos Masi, to all the nurses and your commitment to providing our families with the safe, quality, and compassionate care that you provide our people of Guam. Siduos Masi.
Thank you, Senator Terlaje. Senator Will Castro.
Thank you, Madam Chair. I want to say I appreciate the nurses and midwives for all you do for Guam. You are truly lifesavers. And I think Senator Tello, my minority leader, you caught me off guard there, really pulled an emotional heartstring. I know this because when my mom was sick, you guys were there. So, excuse me. When my mom was sick a couple of times, it was the nurses who lifted her up beyond the practice of medicine. You're caregivers of hope and angels of hope. I thank you for that. I want to share a happy note. My daughter's in Texas. She's a new LVN, LPN. So I know when I'm much older and in need of good health care, I'm going to be in good hands. And so to the nurses and midwives, thank you.
That is great news, Senator Will, and thanks to my colleagues for those remarks. And this is a very emotional presentation. It can't not be. It just is because of the times we are in and the work that you do. So from our birth to our death, Siduos Maasi. Again, it's truly an honor to recognize and commend all of you, each of you, on behalf of the Guam legislature and the people of Guam. And I pray for your unremitting strength and perseverance. I pray for your safety and your continued determination to strive for the highest standards of care for our people. And this resolution presentation is now adjourned. Siduos Maasi, thank you. Thank you very much.